So I think my job has three main components really. I work in a psychodynamic psychotherapy service which is based in a mental health trust. We get referred patients from all over our organisation, and our role is to offer a kind of consultation and treatment service. We offer individual psychodynamic psychotherapy and have a lot of groups running in the service as well. And our consultations are often held over several interviews. And I think the kind of therapy we offer seeks to look at the underlying issues behind the person's presentation. So often people come to our service who've had counselling, CBT treatment, other forms of psychological treatment, which may have helped them, but they feel they want to look in a bit more depth and reflect about themselves, and in particular reflect about the impact of childhood experience upon their development, their ability to form relationships, their symptoms, and what they may struggle with in adult life. So one aspect of what I do is working in that sort of treatment service. Another aspect of what I do is working with colleagues across the Mental Health Trust, because I think a psychodynamic training equips you really with some of the tools to understand unconscious mental processes, such as the emotional impact of working with disturbed states of mind upon staff, the ways in which people may communicate through their symptoms, difficulties or distress or traumatic experiences they're not able to articulate, and how it can be very helpful working with staff, for example, in an inpatient unit or in the crisis team, to have space to think about the patient in more detail and the dilemmas that their symptoms may express. So another aspect of my work is working across the organisation with colleagues in different teams, usually through setting up reflective practice or specialist panels. We have complex case forums, we have risk panels, we have reflective practice in most of our teams. So that's the second area of my work. It's not the clinical work, it's not just within my own psychotherapy service, it's also more broadly, because I think a psychodynamically trained psychiatrist has a great deal to offer to our colleagues in different parts of the mental health services, trying to increase how much psychological understanding can help understand the presentation or the dilemmas that the teams may be struggling with, and support and understand their patients better. The third part of my job is a training role. So in the UK, all core trainees are required to see a psychodynamic long case for a year, and also to attend a Barnet group. So I've been supervising core trainees in psychiatry with their long cases for many years, as well as running Barnet groups. I'm the psychotherapy tutor for my organisation, which means that I also have a role in supporting psychiatry trainees during their training with these mandatory components of their work. And I love doing that. It's a great opportunity to see people develop skills and confidence in their ability to help and understand their patients through talking therapies. One trainee recently fed back to me, I had no idea that my relationship with the patient in itself could be therapeutic, and that's really changed the kind of psychiatrist I think I'm going to be. And it's wonderful to hear that. I really enjoy that part of my job.